Looks like we are live here, folks. Welcome. My name is Dr. Tymo, and I am with an awesome interviewee today, Dr. Jeff Styba. Very excited to have you together here, sir.
Thank you. I'm excited to be here. This is
Yes.
awesome.
Good. And it's something that we get so often in our practice is questions about essential oils. And I know myself, my wife, we've just started using them. We don't really know a ton about them, so I'm probably as excited as anyone else to be interviewing you today. Just because I think there's a lot of maybe unknown about them. It seems so simple, so small. It's just an oil. What can it do? So what we want to talk about today with Dr. Jeff is really an overview of how they work and really how can you apply them if you're a mom, if you're raising kids, what can you be doing at home to get the most out of these? So before we go in maybe to how they work, can you share a story, Jeff? Do you have maybe something that would catch people off guard, be like, whoa, I didn't know essential oils could do something like that. Do you have any stories of kids that you've worked with or families?
Yeah. I mean, there's so many. And just to before I tell the quick story, I just want to say that, just develop a little bit of context for everybody.
Yeah, you bet.
Essential oils, think of them not as just for aroma, because really the aroma of essential oils is the side effect. That's like that's like an added benefit of smelling like whatever oil that you're using. So there's a ton of aromatherapy benefits to essential oils, but we have to think of essential oils as plant-based medicine.
Okay.
And so from biblical times all the way till now, there's written records 3000 BC, or 3000 years ago in Australia for using Melaleuca as medicine, first line of defense for everything. There's 256 references to oils in the Bible using, 33 different oils are referenced in the Bible. So there's plant-based medicine has never changed, and it's only gotten better with our distillation, how we distill the oils. Yes. So really, really awesome. So in context, that's what I want you guys to think of it as, is plant-based medicine.
And that makes sense too, because a lot of when I'm flipping through the different oils that we have at home that my wife bought, a lot of the names are familiar. So it's not some brand new thing that was just invented.
No, yeah, they're historic, man. They go back forever. So some of the my favorite story and most recent. Here, hang on one second. My dogs are fighting. I'm gonna get my wife to grab them. Hey, love.
Here. All right. Well, he's getting his dogs arranged. It's just really cool to be seeing something, because obviously in our office we're looking at doing things holistically and without some sort of artificial. And so I think that's what he's going to go into here, is more about how it is. It's a natural way to work with people rather than something artificial. So, all right, but go on to your story then, as long as the dogs are good.
Oh yeah, thanks, man. Okay, so we had this mother called me. This was about 6 months ago now, and she was referred to us from one of the doctors that we work with essential oils. And the mom called me freaking out one day because she went through this story. Her daughter was 3 years old and was having 50 myoclonic seizures a day. And so she goes to the hospital, they do the workup, and the doctors gave her the option, and it wasn't really an option. They said, you need to take Depakote, and we need to do this every single day for the rest of her life. The mom researched Depakote, and the side effects are horrendous of this drug, and also a drug that's never been tested on children. So there's high risk of giving a young child Depakote. And so she called and she was like, what do I do? What can I do? And so we gave her a protocol of frankincense, copaiba, and sandalwood, 3 really powerful essential oils. And said use 3 drops of each 3 times a day. And that's going to be your daughter's protocol. And let me know in a couple weeks what happens. She called me back a few weeks later. She had 1 seizure in 3 weeks. Wow. And that was the last one that she has had. And now it's been 6 months and she's only using essential oils. So about a month after that phone call, she goes back to the hospital to have another workup done to see how she's doing. And there was a nurse practitioner. The doctor didn't even come in. It was the nurse practitioner that came in and said, I see you haven't filled your drugs. What's the problem? And so mom said, we're not taking them. We're using essential oil. She's had one seizure since I was here last time, and she was having 50 a day. And the nurse practitioner turned her into child services. And so child services was going to take her daughter from her if she didn't give the drug daily, and they were going to check with a weekly blood test to make sure that she was giving her daughter the drug. Otherwise, child services was going to take her daughter and force feed her this drug. And so we had really quickly, I was like, all right, what's the solution? What are we going to do to get child services off your back? And she's like, we need 3 neurologists to sign off on her chart that if she doesn't take the Depakote, she won't die. Because what this hospital is saying is she doesn't take the Depakote, she's going to have seizures and die. And so we quickly called around the country to oil-friendly neurologists. We faxed her medical file to each one of these 3 doctors. They signed off, sent it back, and got child service off. And of course, they've never been back to this hospital. But wow. This little girl is doing incredibly well just from using her essential oils. And so there's a tremendous science behind why that is and how this happened, which we'll get into a little bit today. But that's one of the most recent, really powerful stories.
That's awesome. That's pretty amazing to think of the impact it's having, like such a quick impact on her life too, you know, yeah. Especially with the severity of side effects and things like that. Some of those medications are so powerful. Amazing.
Yeah, and of course, every parent would want to find a natural solution, then obviously give a powerful pharmaceutical like that if we can do that.
That's what I was saying when you stepped away for a moment, was just how in our office parents are coming to us obviously for a holistic approach because they're tired of covering up the symptoms, and they're looking for something that's going to get to the root of things, get to the cause. And you mentioned oil-friendly neurologists, so I know in the medical world, they're obviously looking for more science, more proof, more hard evidence. So if you're having oil-friendly neurologists, there must be, you know, there are people out there that I'm sure that actually have seen the science, seen the literature, and said, oh, wow, there actually is good reasoning behind these things.
Oh, man, there is so much. What a lot of people don't know is there's tremendous research out there on essential oils. And the majority of the pharmaceuticals on the market today, the active ingredient in the drug. So for example, like ADHD medications like Ritalin, Strattera, Adderall, Vyvanse, Concerta, the main active ingredient is methylphenidate, and methylphenidate is a derivative of vetiver essential oil. And so methylphenidate synthetically has tremendous side effects, which we see in these ADHD drugs, but the chemistry and the molecules in vetiver are almost identical in chemistry as methylphenidate, but it's plant-based and it's natural, and it has the exact same calming effect, but is a much better solution than putting your child on a pharmaceutical like that. Yeah.
So is that some of the core then of how essential oils do work? Is it's taking what maybe medicine would say, oh, this is the one particle you need, and they'd condense it down and artificially give just that particle, but essential oil has that, but it's coming from the whole plant, so it has more of a holistic approach. Is that part of how it works?
Yeah, it very much so. I mean, there's like lavender, for example, has over 200 molecules in lavender. And so everybody knows like lavender is calming, right? So everybody knows if you're stressed out, you put on lavender. If you want your kids to go to sleep, put lavender on their feet before bed, or diffuse lavender. It's a really calming essential oil. The molecule responsible for that is called linalool. And linalool, so out of 200 different molecules, linalool is the major molecule. It's the highest percent in the oil.
Okay.
And that's also the molecule that is aromatic. So you're not, when you smell lavender, you're not smelling 200 molecules, you're smelling 1 or 2. But the main, because not all molecules in oil are aromatic, there's only a handful. So you're only smelling that molecule. So the more potent the major molecule is, the more predictable result that we get, and the more pleasant the aroma is going to be. And that's why we are very careful with what companies or what company we use with essential oils also.
Yeah. I could see with anything like that, the purity is so important. The quality is so important, and knowing that you're actually getting if you're using it for a certain benefit, you want to make sure that it's pure enough to have the one thing it needs, or the combination probably of things that it needs to get that benefit.
Yeah, there's two layers. I mean, there's purity, which is important. That just purity makes them safe to use on yourself, your children, ingest them. But potency of the molecules, that's what actually makes them work. And that's what gives us that predictable result. So if we step back to all the research out there, I mean, our company, we have partnerships with 125 hospital systems across the US, like Johns Hopkins, Vanderbilt, Duke, University of Arizona. All the major hospital systems are using our oils in their hospital with protocols with patients because of not only the purity, but more importantly, the potency of the molecules. Yeah.
So the potency means I can't just go pick a bouquet of lavender and I'm smelling it, or I know we have like a citrus one at home, so I can't just squeeze a bunch of orange juice in my water and drink it. Is that sort of what the potency part means?
Yeah, that's exactly what it means.
Down enough? Okay.
Yeah.
All right. What would you say with families out there, or especially say with this last flu season? I know a lot of the families we see in our office are saying, "Yep, my kids were sick, so we've been dosing the essential oils at home." How does, because flu is so common, or maybe not flu, but the sick season that we've had, the immune system piece is something that all parents are always working on. What would you say? How do essential oils help with the immune system?
Okay, so very, very much so. I mean, they're one of the easiest things to use on your children for prevention and for supporting their immune system. So like my daughter, for example, she's 6, and we have another one on the way that's due in June, which this new baby will be oiled up as well. but so yeah, she's 6. She's had oils since birth. She's never been like symptomatic more than 24 hours.
Okay.
And never had a drug, never had a vaccine, never been to a doctor before besides chiropractors. They're the only doctors that she's ever seen. And one of the reasons why is because of the essential oil use. So if it's a virus, if it's a bacteria or a fungus, we have oils to help kill those things. And then we also have our daily use oils for prevention. So if it's okay with you, I want to kind of talk about both, like what we use for both.
Yeah,
cool.
Absolutely.
So, and I think your audience and your patients will really find some value in this, because when it comes to bacteria, like there's gram positive and gram negative bacteria. So like a gram positive bacteria would be staph, strep, MRSA, pneumonia. These are all bacteria gram positive. Yeah, Yep, all gram positive bacteria. Gram negative bacteria would be more foodborne illnesses like Shigella, Salmonella, E. coli.
Okay.
And then you obviously have your viruses, and a lot of viruses cross the blood-brain barrier, live in the spinal canal, which makes viruses very difficult to get rid of, especially like the herpes virus, HPV, the herpes zoster, think shingles or chickenpox. Those viruses live in your spinal canal, so there's not a drug that you can take to get rid of it, because the majority of medications don't cross the blood-brain barrier. Whereas essential oils do. The molecules are very, very small. And so essential oil molecules will pass through across the blood-brain barrier, get into your brain, get into your spinal canal, and can help destroy these pathogens. So with that being said, I always recommend making a roller bottle for your family in times of crisis. So if somebody's getting sick, if they're starting to have like strep throat, red, the spots on the back, the white spots in the back of their throat, and the blend that we recommend, there's five oils. So cilantro, that's what we use for gram-positive bacteria. And there's research that supports it kills gram-positive bacteria in 1 or 2 days. So for gram-negative bacteria, we use oregano and thyme oil. And then for viruses, we use an oil called helichrysum and clove. So the 5 oils are cilantro, oregano, thyme, helichrysum, and then clove. So regardless what the pathogen is, if you just make a simple roller bottle like this,
Mm-hmm.
and you put all 5 equal parts. It would be 26 drops of each in a roller bottle.
Okay.
Anytime somebody in your family is starting to get sick or come down with something, these are hot oils. So these are oils that you don't necessarily want to ingest. They're very hot. So what you would do is you just apply them 3 times a day on the bottom of the feet of,
Mm-hmm.
your child who's not feeling well, or yourself, or your husband, or whoever. And then make sure you all are using this on the bottom of your feet 2 or 3 times a day. And always within a couple days, everybody's feeling better. So you won't necessarily get the full-blown flu or the full-blown infection, because as long as you're using your essential oils consistently, then that's going to support your immune system in killing off these pathogens.
Awesome. And I love that you don't have to be a scientific researcher or have your microscope out to see if it's gram positive or gram negative.
Yeah, it doesn't matter.
That as much as I like the science.
Yeah, in this blend, you have it all covered.
Cool.
So you don't have to worry about it. All you have to worry about is who's not feeling good.
For their core health of the day-to-day stresses that they deal with. But then if there's extra stress, like sickness or a test or something like that, then they get some boost care as well. So I can see essential oils, you have your crisis version. But then what about the sort of the day-to-day maintenance for overall health? What do you recommend for that?
Yeah, so just for daily prevention, man, my wife and I, we use like 20 oils a day. But if we could
down to your top 5.
All right, if we were going to do top 5, it would for sure be a blend called On Guard.
Okay.
On Guard is a blend. It has wild orange, cloves, cinnamon, peppermint, and eucalyptus. So this blend specifically has been studied to help kill 70 different types of pathogens. So we do that daily when we travel. We use it more. We put it on our neighbor on the airplane. We're always On Guard everywhere. So On Guard would be number 1. Number 2 would be your favorite citrus oil, because like my favorite right now is grapefruit. People like lemon, wild orange, but citrus oils are very unique because they stimulate glutathione production in our liver. And so glutathione is the number 1 detox molecule in our body. We can't really consume glutathione because it's destroyed in our stomach, but we have to use the ingredients to make glutathione for our liver to make it. So citrus oils are really great for detoxification and healthy for your liver and kidneys. So and they're also very emotionally uplifting. So On Guard, and children love them. Like my daughter has never had orange juice in her life, but she asks for it, and her orange juice is like sparkling water and 3 drops of orange oil.
Wow. Okay. So that one is safe for consumption if you dilute it in the sparkling water.
Yeah, most oils are safe. I mean, if there's if an oil is safe to consume, there's going to be a food label on the back of it.
Ah, okay.
Yeah, if there's not a food label, it's an oil that you do not ingest.
Got it.
So On Guard, lemon for detoxification. Number 3 would be frankincense, because frankincense is really good for everything. Kind of the theme or the context of frankincense is when in doubt, use frankincense.
Okay.
So if you have something going on, you don't know what to use, frankincense will pretty much take care of it. It's one of the most molecularly diverse essential oils. For women who love their appearance, it's the most anti-aging oil. So you can mix it with your skincare, 3 drops in your skincare, and put it on your face. It's going to help with a beautiful complexion.
Nice.
So frankincense would be number 3. Number 4 would just be lavender, because lavender helps us sleep. It helps you calm down. Anything that we can help stimulate the parasympathetic nervous system is going to be good for us.
The slowing down part of the nerve, brake pedal, especially in today's world. It seems like we're so amped up in the gas pedal all the time. So I agree. Slowing down is good.
Yeah, and even when we're on screens all day, iPads, computers, phones, that's just so stimulative to the sympathetic nervous system that it takes a lot of people. I mean, you can attest to it, but a lot of people that you see, they probably come to you because they don't sleep well at night and they want help sleeping better. Yeah,
their nervous system is just so wound up. The gas pedal's on, the fight or flight. It's go, go, go. and they do have a tough time slowing things down.
Yeah, so lavender is really good for that. So we use lavender every single night. We diffuse it on our nightstand, and then we also put it on before bed. And then the last one would be a blend called Breathe, just because most people don't breathe well, either because of sinus congestion or they have symptoms of asthma or breathing issues. There's so many different pathogens that we're exposed to in and out of the home, in and out of different businesses, synthetic aromas and candles and scents all over the place. So a lot of us don't breathe well, and breathe essential oil is, as soon as you don't ingest this one, but you use it topically or in a diffuser, and it's a blend. It has peppermint, Ravenzera, Melaleuca, eucalyptus, cardamom, all the oils that open up your airways. So it decreases mucosal inflammation, like in your sinuses, trachea, lungs. And as soon as you use it, it just opens everything up. You can breathe incredibly well.
Nice.
And so that would probably be the fifth one. And we use Breathe all day long also, before a workout, before we go for a walk. If we're tired, we want to feel invigorated. And then also we also put it in the diffuser at night as well, because the more you can keep your airways open at nighttime, the more oxygen you're breathing in, and the more your body can recover and heal.
Definitely. Yeah, it's such a core piece. Just like we need calories to move around and work out, all our cells need oxygen to be alive, be invigorated, be healthy. I could imagine it being kind of like going out in the mountain or somewhere out in nature, and you get that big, deep, fresh breath of air where it's just like so pure and so clean, and instantly you feel invigorated with it.
Oh, yeah. Yeah,
it's awesome. Well, I think those are great, because I know with essential oils, you can look at the list and see, holy cow, there's so many to choose from. Where do I even start? So the top 5 list is super helpful.
Yeah, and I just want to throw this in there too, because just like chiropractic care, there's no long-term benefit to chiropractic unless you're getting adjusted regularly. And there's also, and that's all the studies, you can get adjusted once and feel pain relief, but if you don't correct it, it's going to come back. Same thing with essential oils. We can use essential oils very powerfully for symptoms, but to achieve the long-term benefit of all the research out there on the oils, how we achieve long-term benefit is daily consistent use. So same with anything: exercise, nutrition, chiropractic, using your essential oils, meditating, praying. Like we get the long-term benefit by consistency. So it's no different than anything else.
Yeah. And that's a big part of what our office likes to promote, is things that are more of a lifestyle rather than a temporary symptom covering up item.
Yeah. So of course you have your core oils that you use daily. Like if you could, find your favorite 5, use those every day. And then all the other ones, then you can reach for those when you need them. So if you're suffering from anxiety or anxious feelings, there's an oil for that, like Melissa oil. If you're feeling depressed or really sad or grieving, there's oils to help, like an oil called Console can help with those types of feelings. So there's our basics, and then there's all the others that we reach for when we need them, either physically or emotionally.
Wonderful. I know some people might be wondering too, when they hear about using them every day, are there any concerns or worries if you are using them frequently like that?
No, so I'll give you, the template on how to use these, it's really easy, and our body doesn't build up an immunity towards them. It's not like antibiotics where they don't work anymore. How we use them is internally, topically, or aromatically. So in a diffuser, or you put them on, or you ingest them. So topical use and internal use are pretty much exactly the same. We get the same benefits. So if you like the flavor, ingest them. If you don't, use them topically. 3 drops are a therapeutic dose. So anytime you're using an oil, you always want to use 3 drops. You don't need more. More is not better. More is just wasteful. 3 drops is therapeutic. The effects of the oils last 4 hours. So our liver metabolizes the molecules after about 4 hours. And then no matter where you apply the oils on your body, the molecules go into your bloodstream, and they're systemic in about 5 minutes. And then the effects, like I said, last 4 hours. So if you're like the little girl story I told about in the beginning, she's going to reapply every 4 or 5 hours, because so she continually does not have seizures. Okay. And so if you're treating something with the oil, then you want to make sure you're using them every 4 or 5 hours until whatever you're using them for is gone. And then you move right back into your daily use prevention. Okay. Wonderful. So, and then you can use up to 12 oils at once. So that's pretty excessive, but it's almost impossible to overdose on oils unless you like drink half the bottle. Okay. But even then, the symptoms of too much oil would be like a mild headache or just a slight, stomach irritation or nausea or something like that. So they're very, very safe for children, safe for dogs, safe for, any of your loved ones. But we do recommend when you're using them topically to mix them 1-to-1 ratio with some sort of a carrier oil, like fractionated coconut oil, jojoba oil, olive oil, even shea butter, because if you put an essential oil on your skin without a carrier, about a third of that oil is going to evaporate before it absorbs into your skin. Okay. So if you use a carrier oil, 1-to-1 ratio, then 100% of that essential oil is going to absorb into your bloodstream. Nice. Okay, that's a good way to help get your value for everything. Yeah. Okay, wonderful. As we're wrapping up here, I know, like, for our office, we don't sell any essential oils. That's why I wanted to interview you today and have a resource for everyone watching. What would be the best way to get a hold of you if they are interested in finding out more? If they want to order, if maybe they have some already and they're not sure how to use them, how can people best get a hold of you? And so we can put this in the link below too, just so. Cool. Yeah, the best way to get a hold of us is we have a Facebook group where we do all of our education, we do all of our videos, and that's our community where we talk. We have dialogues and answer questions and things like that for our group. Awesome. And the group is called The Oil Lab. The Oil Lab. Okay. Yeah. And it's a group. So you will search for The Oil Lab, and then you'll just ask to join it, and then we'll accept you in. And then once you're in the group, then you can ask us any questions you want. We can communicate. We can help you get set up, whatever you want. Yeah. Perfect. That's a wonderful resource. I think we'll all appreciate that. Cool. So yeah, we'll put a link for the Oil Lab as a Facebook group below here. And anything you want to end with then, Dr. Jeff, before we close off for today? I guess the only thing that I just want to encourage everybody, if you're not into essential oils yet, I would encourage you to start, dipping your toes in the water, because it's one of the easiest things that you can do for your family. And it's a very nurturing, a very loving thing, especially if you have children, to be able to take care of your family's health with plant-based medicine like essential oils. I know it can be very overwhelming, and I know it can be, you seem like, there's 80 some different oils that our company has, and it can be overwhelming. So I just say if you're not using them, start small and just kind of go from there. And once you start using them consistently, you're going to start seeing incredible results with your family, and you'll fall in love with them very quickly. Awesome. Yes. Well, thank you so much. I really appreciate your insights and your time. I know this is going to be valuable for a lot of people because we have so many people asking us questions. And as mentioned, if you're interested in more, Dr. Jeff is the expert, and he is happy to help. So thanks so much for your time, and look forward to connecting in the future. All right. Thanks, Ty. It was a pleasure. Same here. All right. Bye-bye.